further ado, I really like this session and Jill's angle that she took with it. A lot of the startups that we work with are targeting the family caregiver or the adult child. But what I like about what Jill has done here is put that person in the middle and recognize that caregiving or supporting and empowering their aging parents is just one aspect of what they're trying to do and get done on any given hour, day, or week. And so I think it's really important to think about these caregiving needs in the context of their larger life. And this really resonates with me personally. I'm in my 30s, balancing my work and career, but also have an 80-year-old dad and an early 70s mom. She wouldn't want me to tell you the exact age, probably. But they're hundreds of miles away, and that's just one of the things that I try to keep track of. And as a gerontologist, I do know the trajectories, and I want to stay involved and connected and be proactive wherever I can. So what's interesting about the two panelists we have today is I think they're representative of the two types of entrepreneurs we see coming into the space today. We have Chris Otto, who's the VP of Product Development for MobileHelp, and he's someone with a 15-year technology, architecture, product development background who's coming into the aging space and really sees how his technology background can help this space. And then from the other side, we have Valerie Jurik from i-SaiSo, and she has a long 25-year history in the aging space and is a certified aging in place specialist, and she's now seeing this problem she really understands well and helping technology come into that. And so what we find with Aging 2.0 is the best teams usually have both of those ingredients. The people who really understand and can empathize with the needs, combined with the people who know the latest and greatest technologies and can bring them to bear against these often complex and intricate problems. So we'll go on to the next slide here. So a little bit about myself briefly, just so you know who I am and why I'm talking about this stuff and why I'm always talking about this stuff. I am an engineer by training in undergrad and then went to Wall Street and did investment banking and corporate strategy for a few years before I made a rather non-traditional abrupt U-turn and went and got my master's and PhD in gerontology. And what I love about the work I do now is it really is at that intersection of business and technology and aging, and it's growing, it's exciting, and there's really meaningful, meaty things to work on in this space and really talented, amazing people coming into the space. And I get up every morning wanting to help these entrepreneurs because my worst case scenario would be that a lot of these amazing entrepreneurs that are coming into the space now get frustrated by the space because there are its challenges, whether it's distribution, which we're talking about next, or not understanding the traction that they expect to be getting because they have this great solution. So we try to help them so that not only will they stay, but so that more entrepreneurs will come into this space and so that we can all create a better future for when we're all the recipients of these types of services. So I run Aging 2.0 with my co-founder, Stephen Johnston. It's a global innovation network started about 18 months ago. And in the last 18 months, we've run 36 events in 10 cities in 3 countries, meeting entrepreneurs from all around the world. We've met over 1,000 startups. And then just this fall, we picked 11 that we're particularly excited about, and they became the first cohort in our Generator Accelerator program. And it's a 6-month program run in San Francisco, and we run it out of a place called the Institute on Aging, which is actually this hub of aging services where there's 2 towers of independent living. We have home care, there's a UCSF geriatric clinic, 2 adult day centers, and I think that's really part of what we need to have innovation in this space is immersing the entrepreneurs among the people who they're designing for. And that came up a lot in that previous session about how do we learn, how do we iterate, how do we test, and how do we involve the end user in the whole process. And so with that, what we see, as I mentioned, is a lot of people are targeting this, the caregiver or the sandwich boomer or the adult daughter. And so I'd like to do something quickly here. Raise your hand if you're a caregiver. Okay, just a handful. Raise your hand if you are a son or daughter with living parents, at least one living parent or in-law, right? So that's our first point. Much bigger market than caregiving if you talk about it in the context of the relationship and the role as son and daughter or daughter-in-law rather than just caregiving. I think it takes a lot for people to self-identify as a caregiver. So I think thinking about just the role that you all play, if I tell you I'm selling something for caregivers, you don't listen. If I tell you I'm selling something for really good daughters and sons who want to be good daughters and sons to their parents, that's a much broader market. Okay, next one. Raise your hand if all of your living parents or grandparents have a smartphone, download apps, and use social media daily. Right, so we're a pretty tech-savvy crowd. Well, you've influenced your parents. Now raise your hand if that describes you. You have a smartphone, you have download apps, you use social media daily. So again, this group, if we target this middle generation, they are likely more connected than their parents. Even though older adults are increasingly becoming more connected, it's a more densely connected group in this age group, and therefore much more potential for viral spreading, quicker adoption, and all those good things that startups really need early in their development. And now finally, raise your hand if you advise your parents or grandparents on technology purchases or usage. Right. So we all just got back from the holidays, right? Did you get asked a technology question or two? I come home and there's always a list of all these different things. And even though every year I tell my dad, I studied engineering, Dad, not VCR repair, I still get VCR questions. Okay, so if you help your family with technology and usage, put your hand up. Now keep your hand up if you're a male. I think this is another misconception about who's influencing decisions here. I have an asterisk around help solve her problems in the context of her full and multifaceted life. And I think just like we've seen men become more involved than previous generations in parenting and on the home front with young families, I think we are seeing adult sons getting much more involved in the caregiving responsibilities, and especially the ones that kind of intersect with technology. So a lot of people talk about the adult daughter, and I would just encourage you not to discard and not think about the adult son who's very involved and influential. So with that, here's where I see kind of these intersecting areas of sandwich tech. And I think the solutions that a sandwich person is looking for really are around connectivity and social. And this is both in her own life or his life, downward with children and also upward with parents. And then wellness and safety, obviously hugely important, and organization and efficiency. And I think we're seeing tools that really help at these areas and sometimes overlapping, and some of these companies may look familiar. And I think what we're seeing is there's usually kind of the mainstream one that goes across generations like Facebook. And then there's something like Tapestry, which is very similar to Breezy, who you just saw, which is kind of trying to be a very targeted interface. And I think there's room for both. Some families need something specific, others are looking for something that everyone's on the same platform. And I think both Breezy and Tapestry do a good job of integrating with existing platforms, but providing a different interface. Similarly, we were going to have a third speaker who got caught up with some of the weather-related issues, and it was AboutOne. And AboutOne is a tool to help families stay organized about all the different information a family has to have. And I think that's a really good example that I think we saw played out by a company called CareZone. I don't know if anybody's familiar with CareZone, but they were launched about 1.5 years ago by Jonathan Schwartz, former CEO of Sun Microsystems. It initially launched with all the language and positioning around caring for your elder parents, keeping their stuff straight, caring for them, and it's all about the adult child and the senior. And what they've evolved to, and I have a hunch is purely because of usage and also feedback, is now it's all about the family. They're looking up and down. They're realizing their target user is the adult sandwich person, and that person is taking care of people on both ends. And so they've really changed their messaging. And I think it's smart. You want to go for the broadest market possible. All right, so with that, we're going to see 2 more specific examples of companies that are really addressing this kind of needs of this adult sandwich child, and we'll see how they're doing it, and then we'll discuss some questions afterwards. So first, Chris Otto from MobileHelp.
Okay. All right, well, my name is Chris Otto. I'm the Vice President of Product Development with MobileHelp. If you're not familiar with MobileHelp, we are America's leading provider of mobile personal emergency response systems, or mobile medical alert technology. Our flagship product is our cellular mobile medical alarm, but we also have a cellular base station in the home that provides access to emergency response, as well as a fall detect solution, an automatic fall detection solution that automatically sends for help. As Katy mentioned, my background is primarily on the product development and the IT side, but I have a very interesting role at MobileHelp as I'm very deep on the technology side, but I'm also responsible for what I call where the rubber hits the road, and where the user, the consumer, adopts the technology. So it's my responsibility to make sure that we're bringing products to market that are very relevant, so we're attacking a very significant real problem, but also delivering a very elegant, simple, and easy to adopt solution, and that's pretty exciting to me, something I'm pretty passionate about. So this is our core suite of products. On the top left, you see our our cellular base station. That base station is very easy to install. It's simple, literally one wire, just a power connection. It uses a cellular connection for in the home. as well as our mobile device, which is for out of the house emergency response. That has cellular technology built in as well as GPS, so that if that subscriber has an event, they can press that button and signal for help, and we can provide help no matter where they are by accessing their location through that. And then both of those products can be paired to one of our pendants. So the basic pendants are on the bottom, and last year at this show we announced our fall detect button with the blue button shown in the picture there. That is actually pretty small. It looks big in that picture, but it's actually not too much bigger than the basic pendant, and we can provide out of the house automatic emergency response when that user falls, when they are unable to signal for help automatically. And now at this show this year, we announced our MobileHelp Connect platform, which is an online experience for that sandwich boomer that is trying to care for an aging parent. And this is a suite of tools that allows you to stay more connected, more engaged in your loved one's life. You can locate them on the map, subscribe to notification events, low battery events, things like this, system tests. Of course, you can see alarm history through the website. But what I'm really excited about are some of the premium features that are available through this website. And the first one, which we're also announcing at the show, is medication reminders. So we're taking advantage of the existing base station that's in the home because this has cellular connectivity to the base station, and we're delivering. We can capture more data in the home, such as if we can deliver medication reminder data to that base station, and then the user can acknowledge that. So the cellular base station in the home already has voice guidance and an LCD display built in, so you can go to our website, you can set up reminders for up to 10 medications, and then the base station will remind the user to take their medication. That subscriber can acknowledge that through the base station by pressing a button on the base. And those events are pushed to our back end so that you can have a history of compliance data on the website, or if you elect to do so, you can receive real-time compliance notifications by SMS, by text messages. And the final thing that we are announcing at the show this week is our activity monitoring, helping keep your loved ones healthy. And we're taking advantage of the fall detect button, which already has sensors on the device that's tracking motion and activity. We're using that now to quantify their levels of activity. We're pushing that periodically to the back end, and then we make it available through the website in a very easy to read bar chart that shows relative activities from day to day. We also have email summaries, so we really focused on the ease of use and simplicity. So for those users that don't necessarily want to log in every day to check activity, we can provide an email summary that shows that mom's been more active this week compared to last week. Really relevant, digestible information in a simple, familiar format. And again, you can also subscribe to notifications. For example, if mom's been inactive for a period of time, then you can get a notification, an alert on your cell phone as well, text message alert. I think that's my last slide. So
Perfect.
hand it over.
Well, go ahead, and then we'll do the questions at the end.
Okay.
Pull up your slide.
Just set the button.
On the right side.
The right side. Okay, thank you. My name is Valerie Jurik, and I am an independent living strategist. Most people are going to say, what is that? That was a name given to me because I have been in the healthcare field for 25 years, and I am a baby boomer. I am beginning to think you guys aren't, but I am a boomer. And I have joined forces with IT people, like Chris would say. He's on the IT side, and Katy is absolutely right that IT and development people need to start talking to healthcare people. And I also know there's people here that are both in the audience right now. So I met Ray Wright, and he started a company called i-SaiSo. To start, he basically went off of my situation currently with my mom. I'm in one state, mom's in another state. 84, single. Well, my dad, she's a single woman, 84 with a boyfriend who's not there that much, but mom's alone a lot. And I call a lot, and she doesn't want to answer the phone all the time. Or if she doesn't answer, I go into panic. I go into fear. I am the sandwich. I am right here. I am the sandwich. And I have my generation of children, and I have my parents. So we developed a product that has no hardware, that has no cameras, that has no sensors, that has none of that to buy. It's basically an application that you download on devices where the technology is today, on Apple devices or any kind of Android, Google device. It's an application that you download. I gave my mom an iPad with the application on it. My cell phone has the application. I'll show you how it works. Basically, the whole premise is that mom goes to the iPad and touches with one finger all these situations, events that I pre-programmed. From 8 to 9, mom gets up. All she has to do is touch with one finger. So I'm going to go with this. Stop there. I'm going to go with this. And so here we go. What is i-SaiSo Well-Being Monitor? It's a family solution to the challenges caring for a senior loved one who's aging in place. And we know that's a typical terminology of aging in place, but that's supposed to be me. So I worry about my mom, and I'm always thinking, should I call her? Should I not call her? What am I going to do? So did she fall? Is she lonely? Is she okay? So what do? We call when we can. So it answers the questions, are you doing all right now? But what about the other times? What about? So, okay, so mom, what can I do for you? A mom is really an 84-year-old woman set in her ways. I'm giving you my true life story. So I talked to her, and I talked to multiple people in the healthcare industry. I work with home care people. I work with physical therapists, occupational therapists. I work with people within the industry, out of the industry, in the house, whatever. So with the conclusion, I'm saying, what would you work with? What would work for you? So we said, okay, let's balance the scale. What would you work with? Mom's afraid of computers until I showed her how easy an iPad actually is. So dignity for the elderly. They don't want to be monitored or being watched, and that was one of the big camera issues. Keep it simple. One of the questions from the previous session before this is like, if people are just aging, what is one feature that you would add into your product? And it was keeping it simple and keeping the ability large so you can see it, but also easy. Here it is again. These are responses from people. Enhance a senior's sense of independence, and that's another point. People, when you give them a sense of independence back, whether it be through hygiene or whether it be anything on their own and not having somebody do it all the time, it is a proven fact that health-wise they get better. Okay, so Big Brother, and that's another issue we talk about, is Big Brother cameras. So we go to Bill. This is Mr. Bill. So we go to Bill, and we show Bill about a tablet. And literally what you see on that front screen, it says, I need help. Yes, napping, I'm out. So are you up? Or whatever question, these are you can write these events yourself. So are you up? And my mother would get up with one finger and hit the yes button. And throughout the day, program questions come up for her, and she hits it. So then she prefers to use a tablet because it's bigger. And I am on the bottom with my relatives. I am an administrator. So as soon as she touches her finger to the yes, we get the answer on our cell phones. Mom's up. And if she has a question saying, did you take your medication today? She hits one finger, yes. Mom took her medication. Comes on my cell phone. I'm the administrator. My brother's an administrator. We're all administrators. So it's important to know when an activity takes place because we know she's up. I don't have to call and say, Mom, you up? She knows she takes her medicine. Did she take her medicine? But what's more important about this, and it's wonderful that she knows I'm on the other side receiving this. You also can hit one finger and get Skype and Facebook with me. She has FaceTime. One finger push, she needs help. It tells me to call her. It's all through the internet, and it's all through devices we mostly already have. So it's good to know what's going on because she hits yes, yes, yes. But what is more important is when we're notified or not notified when something has happened as expected. So what this does, if it says, did you have lunch today? Between 12 and 12:30, Mom's scheduled for lunch, but she doesn't tap it. At 12:31, I get a message on my text saying, Mom has not replied. So in 15 minutes, if she still doesn't hit that button, I'm getting alerts via text and email that Mom has not hit it. So if I don't respond to that, because I can override, I call, Mom, what's going on? And Mom says, oh, I was sewing, I forgot. I can override, and everything goes back into the schedule of events. If I call and Mom doesn't answer, what happened? Why didn't she touch the tap? So I know that something happened because of her not answering as opposed to her hitting a button or doing something else. So it's an escalation. Now, if I'm busy, I'm here, and my phone's going off, I don't answer, my brother is a second administrator, so he starts getting emails and text messages that mom did not put her finger and answer this. And if he's busy, it goes to my sister. So I have set up, you can have as many administrators behind you. So if mom doesn't hit the button and it sends a notification, I get notified. And if I don't answer it, my brother gets notified. It goes every 15 minutes for 2 hours. These alerts will continue up to 2 hours until the event is satisfied. So that's the whole, what i-SaiSo is a download of an application using the instruments we already have without having to get more instruments or buying anything else of hardware. So that's why I joined with the IT people and the engineer people to put the idea of healthcare and what's needed and the easier way for people to maneuver around and being noted that they're being okay without feeling like they have to call all the time or they're being called all the time. So that is the i-SaiSo Wellbeing Monitor. It's an application you download, and we're good, right?
Wonderful.
Thank you.
Join us over here on the couches. Well, thank you both.
You're
Let's give them a round of applause, and then we'll have some questions. All right. So if your primary target is the adult child, can you tell us about your go-to-market strategy? How are you reaching this adult child who's making the purchase, and how do you reach them? You've been doing it a while. You probably have plans, and we'll see how they go. So maybe we'll start with Chris, who's been doing it.
Okay, so yeah, we are. We're targeting the adult child. We're also targeting the parent of that adult child. So it's a tough challenge. I mean, as I'm sure Valerie knows as well, it's you need buy-in from all the stakeholders. So a lot of our marketing, a lot of our current go-to-market strategy with our flagship product that revolves around safety is really focused on that elderly parent, believe it or not. So a lot of the messaging is targeted to the elderly parent. You know, a lot of the media channels that we advertise in are targeted to that elderly parent, and that is because we found that you know, if we market to the child, then they have to turn around and sell the elderly parent, and sometimes the sales process breaks down in that process. So ultimately, we know it's that elderly parent that makes the final buying decision. So a lot of our marketing is directly to the elderly parent. Now, what we're doing with some of the new platforms I mentioned and where we are announcing at the show today or this week is we're shifting that a little bit. So a lot of those really, like the activity monitoring, is really squarely focused on that child. So we're shifting that, we're changing that. We're using you know, internet search more and web to reach them. So that's so we're kind of evolving our marketing strategy as we go to market.
And with your initial product, did you always market directly to the older person primarily, or did you start with the younger and then evolve to more later?
We tried both, and so you know we you know, it's kind of almost counterintuitive. We expected that the buying process would really start and end with that child, but we found kind of the hard way that elderly parent is really the one we need to be marketing to.
I think this is a good learning for everybody. I think very often we hear, and you would never see this in other industries, like, oh, I'm just going to buy things for someone and not, you know, involve them in the process. And I think generally for our space to have more success, we need to involve older adults in the product development side of it, and then in the purchase decision and consideration. So I think that's the person who ultimately you need the buy-in from, because it's in their house and on their body. And so I think balancing that is certainly one of the challenges of our space. You have two people you're talking to, and they need to agree, and it's a very considered purchase. Tell us about your plans for go-to-market.
Well, today is our first day of launch. We're launching today. And it's been incredible this morning with the healthcare industry itself. And our marketing is online and offline. So we're both with that, and we're also huge with social media. We have a whole social media department, and they're using all these kids and a lot more than I know and I'm used to, but everything in the healthcare stream and just the marketing, yes, the adult. Again, I'm the sandwich, so I have this side and that side. So what I know, the kids and how they get on it and how they're with the older parents. And the generation of using technology isn't just the 30 and 40s. I'm talking to people in their 70s that are on the internet and doing, so that marketing is broad. It's broad across, and it's through organizations that have independence concerns, and that's where we're launching through.
I think that's another great kind of common misconception and pitfall in this space is that you can't do online
Right.
to reach the oldest old. And I think, they're the fastest growing group on Facebook. I think, referrals and viral stuff is still very much possible.
100%.
In this space.
It's
and I
growing.
think trusted recommendations
Yes.
carry a lot of weight. You mentioned there at the end organizations who are already working with older adults. And I think we see that a lot where a startup might start and say, I'm going to be direct to consumer. And then they evolve from B2C to B2B2C because it's these organizations that are already working with older adults and already have the trust and the understanding of the needs that kind of become a distribution channel. So is that part of, do either of you go through aging organizations
Home
or
care
healthcare?
agencies and stuff, yeah. I'm working with 2 franchise home care agencies across the nation that want to work with the home care caregiver, the caregiving person, and their clients and whatnot, and how to work with that. And within assisted livings, we're talking to many people that are trying to communicate. It's B2B, then B2C, and we're doing both of those, business to business, business to consumer. And there's a lot of interest out there of how to do this without buying additional product, and they're trying to integrate. So we're a blank slate, and what they're trying to do is it's wonderful what they're doing. They're more concerned about their nurse that's going to the client. What has been done? Has the medication been taken? What is the, and so it's going to go.
So
It's
you're
great.
also thinking about enterprise solutions?
Yeah,
Because what the nurse is doing is different than what you showed us.
clinical and non. We're non, but we've been since this morning. This is my first CES. It is insane, but it's great. It is fabulous. A lot of clinical are coming, but we're not clinical yet. I showed you. Are you okay? Good, and it's all through not phone calls. Can we launch clinical? Yeah, but I'm not there now, and there's plenty of companies that are there. But yeah, it's an amazing. It's a wonderful vision of what's going to be.
What about you and the kind of enterprise or going through organizations? Is that part of your strategy?
Not so much. The solution is really a consumer tool, and it's our go-to-market has been all direct consumer. So there are some companies in our space that are going through more institutional settings and healthcare organizations to reach that consumer, but we've been very successful at just directly marketing to the consumer. We have some wholesale partners that help us, but it's still really a consumer play. I think one reason maybe why we've been successful with the direct consumer is because the brand and the imaging of the brand is really about a mobile, healthy, active lifestyle, and so I think that resonates well with the elderly parent and the child as well.
Perfect. That was a great lead-in. So I think brand is really important, and how we talk to and about the services, especially in this space. There's a ton of landmines. Could you tell us a little bit about both your brand decision and then kind of your positioning and how you position your services and the value proposition you put out there? So your name's MobileHelp.
Yes. So the name is pretty descriptive. We're in our positioning statement, and we are the number one in America mobile medical alert system. And the name, the MobileHelp, I think is pretty descriptive of what we do. But I think mobility also, and we reinforce this with some of the imagery on our website and our materials, is also implies a healthy, active lifestyle, a little more ambulatory. Our average subscriber is 72 years old, which is kind of a younger senior, and so I think that's who we're marketing to as well, somebody that is outside of the house, and one of the main advantages of our solution is that you can provide that safety and protection outside of the home as well as in the home, and so that's really important to us.
Yeah, I think to clarify, mobile PERS versus PERS, can you describe the difference?
Sure. So
the
PERS are personal emergency response systems, or medical alarms. They've been called several different things. Have been around for decades, and you're probably familiar with the classic pendants. You fall in, you press a button to get help. That's the basic category of product that our solution is the same category. But a mobile PERS is one that works outside of the home. So I don't know if everybody knows this, but a typical standard medical alarm system works with a static phone line in the home. So it's a landline. Those are going away, by the way. So that's another advantage of cellular. But our solution is designed to work outside of the home as well. So we use cellular connectivity and GPS to provide that response no matter where they are.
Great. What about you? Tell us about the brand and i-SaiSo.
Well, my branding is not i-SaiSo. What'd you say? i-SaiSo is great, and I love the concept. I'm an educator. So I educate people about products that are available, services that are available to keep people at home longer, if possible, before going to a nursing home or assisted living, because there is that group. People can stay at home if they're empowered. And education about products and servicing is extremely empowering. So if I can empower somebody through knowledge, okay? If I can empower them with knowledge, I can give them a voice in a decision when it's talking about them. So instead of telling my parent, this is what you're going to do, they can engage in a conversation because they're knowledgeable at this point with services and product. I'm getting there, hang on. So when we do that and we engage, I give a voice for choice. That's what I'm calling it. If I'm giving you education and you get it, you can voice for choice. You can engage in your own conversation of your destiny, let's just say. So if I say to Mom, what would you want to have? And she says, well, I want that one finger touch solution, the monitor. And I say, why? She says, because I say so. You get it? So it's basically telling somebody to choose it because I say so. I want to, and I know this is simple for me to do. Simplicity. It's something I want to do because it's simple. And that was their whole, and I thought that was, so it's not as, I know most people have like a grab bar is something you grab, or a wheelchair is a chair that has wheels, but it's not as obvious as that. And that's the branding of it. And so I totally lost track of what you even asked.
No,
You see
about how you came up with the name.
You see what happens? I
and
just
the reason.
go.
So I'm going to ask a slightly harder question. So I think products in this space, and particularly things around kind of monitoring and checking in on someone, and or some of the kind of wearable devices, have some stigma or have had some stigma traditionally. How are you guys handling navigating that, making this something that some people want instead of something that there's kind of thrust upon them? And I think I'd love to hear how design plays into that as well.
Yeah, that's a tough challenge. As Valerie said earlier, there definitely is resistance to some modalities of sensors and monitoring. So we don't use any cameras. We don't have any very obtrusive monitoring devices in the home. And we try to, everything that we're doing is taking advantage of kind of a minimalist approach. So because this category of product has been around for many years, we're delivering a system that is very familiar in this space. So we have a pendant, I don't have it on me, but we have a pendant that you wear around your neck, and then a base station in the home. Yeah, there we go, that's thank you. So this is the Fall Detect pendant. And so we deliver a very familiar system. So I think we have some history, I guess, to our advantage. And so we've modeled it after existing products in the space that we know are already have already been adopted. But then as we roll out some of the new things like activity monitoring and medication reminders, there's maybe a temptation to add new products and new devices and new things in the home, and we've been very resistant to that so that we can make it as easy as possible for that subscriber to adopt the technology, make it easier. I mean, kind of the same strategy that Valerie mentioned. You're using things that are already familiar to them. They've got devices. We're doing the same thing with the devices and products that we're already delivering. There's no new platform in the home. This same pendant that is used for emergency response is also monitoring activity. The base station in the home that's used for the emergency communication with the central station is the same platform we're using to deliver medication reminders. So that's been our approach to that problem.
And I noticed the watch that you guys had on. Is that the one you have on?
No, this is actually a real watch, so sorry.
But I think, so no offense, but I've heard people say that some of these look like a garage door hanger hanging around your neck, and that someone doesn't want it. So what made you guys create the watch, and how much emphasis on design are you doing going forward?
Yeah, so I think design is really important to us. We want it to be easy to use, lightweight. We would love it. In fact, if you stop by our booth, we have a pendant that's actually looks like jewelry, so it's beaded and the lanyard's beaded. So it's maybe not something I'd wear personally, but we get a lot of compliments on that. So we do put some emphasis on that.
Great. And I'll just leave a final thought, because I know we're wrapping up on time. Sure. Is this is about the sandwich, and so as you're evolving, I'd be curious to know: are you thinking about, you're right now using the middle generation and up, and do you give any thought to a kid safety product? Or
we're doing, we have both. Well, there's a sandwich generation, but there's something called the club sandwich, and you know about that, right? So really, if you're 30 or 40, You're here, 30 or 40, you have young children, you have your parents, and then you have your grandparents. So you have that line of 4. Or you're 50 or 60, you have older children and the grandchildren, and so you're in that line. So monitoring or wanting to know how someone is without having to call, it's irrelevant of age.
Great.
If you think about it, it's irrelevant of age. So that's what we're using. And we're also using technology, like we said with Chris. It's already out there. People are progressing to iPads and phones and technology that way. So yeah, we can go across the boards, plus with business to business and healthcare industries and stuff like that. So.
Perfect. Well, I think we're low on time, so if you guys, we don't have time for Q&A, I don't think, so we'll just, if you want to talk outside while the next group gets started, we'll be out there.
Sure. Thank you very much.
Thank you very much.
Thank you.
Thank you.